This is Dr. James, and today we are going to talk about RSV. Now, I need a favor from you. If you like this video and you feel that it would help other parents, please like, comment, share. That's the way the algorithm picks this up and shares it to other people so more people can see it. So RSV, it stands for respiratory syncytial virus, and that's the actual name of the virus, not actually what it does. In most kids and adults, RSV is just going to be a cold. You could have some fever, you should have some cough, runny nose, congestions, feel bad. That's what it's going to do in most people. But in the very, very, very young and the very, very old, this can actually be a life-threatening illness. Now, I'm going to concentrate on the very, very young. So you have probably at some point heard a doctor, when you came in with a cold, diagnose you with an upper respiratory tract infection. That's a fancy name for a cold. And it's because it affected mainly just the upper stuff. You had congestion, you had runny nose, and the cough was caused by drainage running down. RSV in small babies can cause a condition called bronchiolitis. This is truly a lower respiratory tract infection, because the bronchioles are the smallest airways as it goes through the different branches from the big trachea down to the tiniest little airways. The tiniest little airway is called a bronchiole. And this is right before it gets to the little air sacs called alveoli, where oxygen and carbon dioxide exchange happens. In this bronchiole, the smallest little airway, this is where RSV infects and causes bronchiolitis. And it causes its problems by causing inflammation and swelling, and mucus is secreted, and then it kills off the cells that line the walls of these airways, and you get all this schmuck that's in there. And then you have to cough it up. That's the reason this cough is going to be so productive, so chunky. And the mucus is very thick and very slimy. The swelling of the airway also causes problems breathing. And in these small babies now, they're going to have to work very hard to breathe. Their breathing is going to be very loud. It's going to be very labored. You're going to hear wheezing. My common joke about this is they're going to sound like a broken washing machine. You're going to hear they sound terrible. You're going to also, when they get into trouble, they're going to have problems breathing, so they're going to work harder to breathe. They're going to breathe faster. And you're going to see them use other muscles to try and breathe. So they may pull in above their clavicle using these muscles. You may see between each rib. You may see underneath their ribs, between their rib cage and their abdomen, them pulling in as they breathe. And these are called retractions. And these are using accessory muscles besides just their diaphragm to try and help them breathe. These babies need really good suction, and sometimes they end up in the hospital. The reasons that they end up in the hospital is sometimes just so we can suck them out better. Some of them need oxygen. A lot of them have to have IV fluids because they're breathing so fast, they're losing more fluid that way. They have fever, so they lose more fluid through their skin. They're choking, gagging, vomiting, so they're losing fluid that way. And then they just feel bad, so they're not eating as well as they should, and so they need IV fluids. RSV is notorious for causing ear infections, so sometimes these kids need antibiotics as well. The babies that are at the highest risk for ending up in the hospital are less than a month old. In fact, in my experience, in my practice, it's actually pretty rare that you have a baby less than a month old that doesn't end up in the hospital. Still pretty high risk from the time they're 1 to 2 months old, and a little scary for any babies that are less than 6 months old. After 6 months old, the babies start to get bigger. As they grow, the airway goes from really, really tiny to bigger around. And as the airway gets bigger, it's harder for it to swell it shut so much that they have problems breathing. RSV cough sounds different. It's a cough that as they come down the hallway, I can diagnose them as I hear them. It's a lot like croup in that way. It just has this very distinctive sound. So in this time of year, and we're definitely starting to see RSV, and this time of year, if you have a small baby and they have a cough that sounds different, or you see them working to breathe, definitely get them into the doctor. One, so we can get the diagnosis and kind of warn you about what to look for, what might lead for us to end up in the hospital or have further intervention. Two, so you know, don't be around other babies so we can't spread this. And three, just so you have that interaction with your doctor, because this is something that I tell people, don't be real brave with. If you get scared, be scared. Normally, I'm very reassuring with my patients. I try and calm them down. I try to make them feel better. But when I have a little baby with RSV, I want them to trust every instinct they have, and I always want them to err on the side of scared. Because if they're scared, then chances are I'm going to be worried too. And so you want to set up that so that you are in communication with your doctor, so that you know that if you have any problems, any setbacks, that you can get a hold of people so they can talk you through what to do. So with RSV season, make sure everybody's washing their hands real well. Stay away from crowded places if you can with these small babies. Try to avoid anybody that you know that's sick, because an adult, it may look like a very mild cold. And sometimes this time of year, it can look like maybe they might just have allergies. But if you have a little baby, try to avoid anybody that's got a runny nose and a cough, just in the case that it might be RSV. I hope this helps you.